Since femtosecond lasers have come to dominate the market, LASIK volumes are down by half in the US. So what can be done to make refractive surgery more broadly available to patients? The question is a big one, and the Med-Logics ML7 microkeratome could be the answer. Here today at AAO 2023 in San Francisco to discuss the solution is Dr. Lance Bergstrom.
Lance, welcome to the program.
Thank you.
So, Lance, can you tell us a little bit about yourself, who you are, what you do, and what's your ophthalmic experience?
So I'm a comprehensive ophthalmologist. We only have just a handful of subspecialists in the state of North Dakota, so patients literally have a choice of driving 300 miles to see a subspecialist, or they can stay locally. So I literally do comprehensive ophthalmology, anywhere from a significant amount of retina to glaucoma to pediatrics to refractive surgery, cataract surgery obviously. So,
you know, Lance, you performed tens of thousands of eye surgeries and used lots of tools.
I have.
Tell me a little bit about the ML7 in your view.
Well, it's the go-to keratome that we use. I think just the quality of the flaps, it's our go-to tool. So I trained in the early 90s, right when PRK was approved, and then it progressed on to LASIK or with the keratome. And initially we all used mechanical keratomes. The biggest struggle with that was patients would have dry eyes, was a significant complication, and occasionally you get what we call a buttonhole flap or issues with flaps. And then the interlace came along, and initially I thought this would be the answer. The technology is very expensive in my opinion for what you're getting. We saw a lot of patients with haze issues, and frankly I wasn't super impressed. You didn't get some of the other complications with mechanical ones, but you had a whole nother set of complications. And so I actually ended up switching to a mechanical keratome that had a nasal hinge, and since then we've progressed and we've been using this newer one. We've been using that now for the last 4 months or so and been very happy with it.
Let's talk a little bit about advantages that the ML7 has over femtosecond lasers. What are those?
What we noticed early on, like with the femtosecond laser versus the mechanical keratomes, is the wow, the initial wow experience. Mechanical keratomes tend to have very pristine flaps immediately, and their visual recovery is very quick. And so we've been very happy with it. We've had no issues whatsoever. Yeah, can't emphasize enough the safety of the procedure. And actually, as far as discomfort goes, during the procedure, it's only like 3 seconds of suction versus the femtosecond laser is significantly longer. To me, there's no comparison once you start using them side by side. Plus, the cost is significantly less. And it just doesn't make any sense in today's environment to have something that costs a fortune, that you can have something quite a bit less expensive that works, I think, better.
How can doctors successfully integrate the pricing structure of the ML7 into their practice?
I think it's always good to give patients a choice. We've chosen, I mean, they rely on you for an opinion about it. You've dedicated your life to improving vision. They trust you. But I think, I mean, you have to sit down with, your bean counters or whatever and take a real good look at it. Unless you're doing a huge volume, which nobody's doing that nowadays, to me it made no sense to go with a femto. But I think the reusable costs, disposable costs, and the upkeep is significantly less on a mechanical keratome. There's no comparison.
We know patients want their normal life back as soon as possible after surgery, right? What does patient recovery look like after surgery with the ML7?
So, we see them immediately after the procedure, and almost always they're always already reading the chart, and then we see them the next morning. Versus the femto flaps, there's a lot more inflammation. If you took them side by side, did one eye with one eye with the other, you could immediately tell which one had the ML7. I think the discomfort is less, visual acuity is recovered days faster in my opinion. The chance of inflammation is less. So, I mean, to me, again, there's no comparison.
If you were to give some advice to doctors considering the ML7, what would you say?
I'd say don't always believe the hype. Do it for yourself and try and compare it side by side. I mean, until you actually do it yourself, and then you realize, oh, okay, that was more hype than reality. I would say see it for yourself, and that's the best way you can tell.
There we have it. Well, thanks so much, Lance, for joining us on the program. We've learned a lot today about the ML7 and lots of other issues, so thanks very much.
Thank you. Have a good day.
All the best.
You bet.
If your curiosity has been piqued, Be sure to check out the Med-Logics website at mlogics.com, where you can find all sorts of neat toys for eye surgeons. Until next time, my friends, see ya!